First tonight, the new research hoping to highlight why seemingly healthy people are at risk from COVID and help those who are still suffering months after contracting the virus. Since the start of this pandemic, the national focus has been on the number of positive tests and the number of deaths. But critics say equal attention should be given to those whose life has been dramatically changed by this virus. People who 6 months on are still unable to walk or breathe properly. They have dizziness and chronic fatigue. People like Annette and Daniela, who've been talking to Nicola Haseler.
This is not how COVID-19 was supposed to affect healthy people in their 40s.
I feel that I've lost something quite substantial in my life by not being able to go out and get fresh air. I can't even walk around to the corner shop. It's been quite difficult to deal with.
In March, Annette was at the gym several times a week and had booked her next hiking holiday. She'd been a fitness instructor in her spare time for 10 years. 6 months on, she's still living with the aftermath of the virus.
The fatigue's been really bad. Throughout March and April, I was mostly in pain and feeling nauseous. I've had really, really bad acid reflux. My legs have been shaky. I've had quite bad palpitations for several months now. I've also had lots of pain in my feet and my hands. It's been like they've been on fire, especially my feet. I woke up one morning very early, a couple of months ago, and it felt like my right hand was melting.
And how is your life now compared to what it was before COVID?
My life doesn't look anything like it used to. I used to walk and cycle everywhere, and I really can't get out of the house now.
Daniela finds it exhausting even to walk around her home after getting COVID in March. She's a genetic technologist for the NHS, but has not been able to work.
You are so tired and so weak and in pain. All your body is such in pain. Like normal stuff, having a shower, brush your hair, brush your teeth, and have a breakfast. For me, I'm done.
Like many thousands of people with long COVID, Annette and Daniela didn't have a test because they weren't available back in March and so are not recorded in any statistics.
The only answer I got was, we don't know anything, your blood test came back all right, you don't have anything, and we don't know.
There are hundreds of thousands of us around the UK, goodness knows how many around the world. But what we ultimately need is for this illness, this long COVID, to be recognised and to be taken on board, to be properly researched. There needs to be funding for research going ahead. And we need help, we need rehab, we need support.
The Department of Health has said the impact of COVID-19 on long-term health is now an important area for the government going forward. Nicola Haseler, BBC Look East.
Well, we're joined now by Dr. Tina Pears, who wants to conduct research into those long COVID symptoms and hopefully bring people some answers. Dr. Pears, you think this may be connected to histamine intolerance. Can you just explain what that is?
Yes, well, we see a lot of patients in my clinic. We diagnose them with histamine intolerance and mast cell activation syndrome. And our body makes histamine and stores it in various cells, predominantly in our mast cells. And when we have an infection, the mast cells release over 1,000 different chemicals, including histamine. And we also have to keep it in balance in our bodies. So we have enzymes that metabolize the histamine away. About 2 to 3% of the population don't make those enzymes very efficiently, and so they get an imbalance with excessive histamine, which causes toxicity in the body and lots of inflammation and many symptoms. But on top of that, we have it's estimated 17% of the population have abnormal mast cells, which are hyperactive and overreact. So, for example, if you have an infection, they react too severely and create a massive storm of chemicals, which then cause inflammation and make people very sick.
So people who are seemingly healthy, could they actually have this and not know about it, which is why we see people who appear to be healthy reacting so badly to COVID?
Absolutely. And often when you take a really clear history from these patients, they've got something in their history that suggests they have actually got mast cell activation and maybe histamine intolerance. And it could be something like IBS or a reaction to various drugs. They could sometimes get hives and itchy rashes, which are not explained. It's a very commonly seen condition, but it's very rarely diagnosed, unfortunately.
So obviously you want to do this research, but is your kind of working theory that someone like this might get COVID, the COVID goes away, but they are left with those extremely high histamine levels, and that's what might cause these symptoms?
Absolutely, absolutely. And we really do want to drill down and try and find out if that's the case. So yes, we've got an app that we would love people to download. It's called People With, and that's written in one word, as one word. And on that, they could record all their symptoms and their past medical history. And that would be a very efficient way for us to quickly look and see if, in fact, their symptoms fit the criteria for a diagnosis of histamine intolerance and mast cell activation.
This is the first research into long COVID that certainly I have come across doing this job. Research, of course, isn't over in a flash. How long do you think it might be before you can establish or de-establish some kind of connection?
Well, the app is incredible, and we have about 60,000 people estimated in the country with long COVID. So the more of them that download it and put in their data, the better. So it shouldn't take us that long, actually, to analyse it and see whether this hypothesis actually could be true. There are many experts in mast cell activation across the world, and they have actually put this hypothesis together that that mast cells and mast cell activation syndrome are actually the key player in severe COVID, that's the acute illness, and in chronic long COVID.
Apologies for interrupting. I'm afraid time is against us. We wish you the very best with your research. We'll catch up again. Dr. Tina Piers, thank you.
Thank you.